Hi guys, welcome to the channel. Today for Mandala Mania 2019, I'll be coloring out of mandalas for relaxation and meditation. This is Camellia Angelclova. It is 40 relaxing mandala designs. I'll just give you guys a quick little look at some of the pictures that are in the book. And you may notice that the images are not exactly centered, and I had mentioned this in one of my flip throughs, and a subscriber had pointed out something that I'd never thought truly. I believe what may have happened was some of her books I believe were designed to be more of the square type books, the smaller books. And because if you look from about here up, it would be perfectly centered. And I think when she just chose to print with Amazon, this is the standard form, so it just kind of moved those up. So I don't think it was a misprint in my book. I expect all of the books that have this issue to be that way. I was kind of curious on that, but it does not bother me. It doesn't affect the book or the images or anything like that. So that's not a big deal at all. It was kind of nice to have an explanation as to maybe why they were like that. Today I'll be working on this mandala. This is the one that I picked out, and I'm going to be using my 80 count Artify Art Supply dual end alcohol markers. It comes in, or they come in a round container or a round case. It's a very nice case. You got your handle, and of course it unzips to expose your markers, and you have 79 colors and I believe there is 80 colors and a colorless blender. So I don't think, maybe this does count as the 80. Give me 1 second. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19. Yes, so there's 79 colors and a colorless blender. Now, this colorless blender looks different than the rest of the markers. This is actually a broad nib or chisel tip with a brush on the colorless blender. It's actually a fairly nice brush too, to be honest. I would love to see, you know, if Artify has a colorless blender like this, if they could get a brush set of markers, that would be awesome. The markers themselves are kind of like a rounded triangular shape, and you have your number as well as a color name on each end of your marker. The nib, the bullet nib is marked with a gray line. Then you have your broad chisel nib. They seem to be very airtight markers, and I haven't had any problems at all with mine. They all arrive nice and juicy and well packaged, nice air seals. Let's see if I can show you the swatches of the markers. So this is my swatch page from these markers, and they're nice. They are nice markers. I bought them actually to complement the 88 shuttle arts. I think they do wonderful together. You guys might be able to see that a little better outside of its sleeve there. Okay, so there'll be links below to the Artify markers as well as to this Mandala for Relaxation book on Amazon. There's been a couple products recently that I've featured, and they've been out of stock on Amazon, and I apologize for that. When I don't decide I'm going to color with something or on something just to put up links to a product. I don't do that. I just choose what I want to color with, and then I just share the links with you guys. So I'm sorry for the things that, you know, have been out of stock, but, you know, that wasn't intentional. And also, too, these lids actually stack on these markers. Some of them do stack and stay a lot better than others, but they are made to be stacked. Okay, so I'm just going to jump right in and just start working on my mandala with you guys. I've been trying to do a few mandalas every day for Mandala Mania, and I thought, you know, I would just sit down, turn the camera on, and maybe color one with you guys. So here I am. I'm not planning any color scheme or anything like that. I'm just going along, and I'll just see where it takes me. Gary did go back to work today, so he's hanging in there. He and I both went to see the doctor yesterday, and we went to we have our primary care doctor is the same doctor, so we went to go see him. Did I say today? I meant yesterday. If I said today, my mind's all over the place. And you know, Gary needed to give him an update from what the surgeons had found and all of that. Our primary care is not necessarily in 100% agreement with what the surgeon found, but he did say that at the end of the day, he's the surgeon and he's going to go along with that. Our primary care doctor actually used to work for a cardiologist in the beginning, after he had first gotten his license. So he knows a little bit about those type of surgeries, and he you know, he wasn't in 100% agreement with what the doctors kind of thought, but you know, he's going to go along with that. He doesn't know, you know, he told Gary, he's like, I really don't know what to do about your blood pressure at this point because of what they're saying. And, you know, he goes, I guess we're just going to have to wait on them to try and come up with some kind of a plan and see if they can figure something out. But he doesn't believe that what they chose to do is going to work, and it's just going to be a long process, which is concerning for him because, you know, he knows that it's not good for Gary to be walking around with blood pressures that are just going up and down and up and down and up and down. And, you know, he said there is medication. If it was a situation where his blood pressure was staying high, that he's got medications that he could give him for that. That wouldn't be a problem. But since his blood pressure is jumping all around, that there's not really anything that he can give him, because the things that he could give him when his blood pressure is not spiking, it would actually bottom him out completely, cause even more problems. So I don't know, but the doctor was very upset about his blood sugar levels and where they've kind of stabilized at in the 200s. And poor Gary, he got reamed pretty good by the doctor yesterday about eating habits and, you know, basically trying, you know, knowing that he's going to have to make a lot of changes in an attempt to get this back on track. He was doing so well, you know, for so long, had non-diabetic numbers. His A1C did not indicate diabetes anymore. The doctor was kind of prepared to start taking him off of some of the diabetic medicine and seeing if he could just manage with diet. But, you know, it all really started with that one prednisone shot when he was sick. And it just kind of spiraled from that. So, here we are. And he upped some of his medications. He's not putting him back on insulin right now. He wants him back in 3 months. But if he doesn't have his numbers back down, then he will have to go back on insulin. So we will hope for the best, and of course be prepared for the worst if that's what ends up happening. So yeah, that was a pretty intense discussion that they had to have, but I mean, it was necessary. And then where I'm concerned, the doctor's sending me to a urologist to have a scope done and take a look at things and see why I keep having these repetitive infections. He believes, I can't remember the name of, I guess, the disease process that he believes I may be dealing with. But it's really funny that I can remember things that are wrong, that's wrong with Gary, you know, like his renal arterial stenosis and, you know, all of those things, but I can't remember what's wrong with me. I guess that just goes to show that, you know, I focus on taking care of my family, and I've always kind of put myself secondary, but I've got to go see the urologist on Thursday. Yeah, Thursday. And I think I'm going to go back over this right here just to kind of make this a little bit too much. And we'll see what my urologist that I'm going to will want to do. I seriously doubt they'll do the test tomorrow. But in the meantime, my doctor put me on a very high dose of antibiotics for 3 days. And then he also gave me a shot of rocephin again. And he said he basically wants to control, you know, try to knock the infection back. We know we're not getting rid of it. I mean, we haven't yet. But he wants to get a good knock back so I'm not having any symptoms. And then after the 3 days, I'll go down to, right now for the 3, I'm taking antibiotics 4 times a day. And then it'll go down to 1 time a day, and it'll be a lower dose, a much lower dose, just once a day, just to try to maintain and keep things, you know, knocked back. If what's going on, if what he thinks is going on is the problem, my understanding is there's some type of antibacterial type medication that you take along with anti-inflammatories, and there's really no cure for this. It's just treatment. You basically have to make the bladder be a non-hospitable area for bacteria to breed in, and so it's chronic something. I can't remember. But that's what we're looking at with me. I think I'm going to do this also. Sometimes I get started and I'm like, no, there needs to be a little something different. But, and I'll add things here and there as I go along a lot of times. So, that's our health update. I am so excited to be on antibiotics yet again. They make me feel horrible. I don't know. When I take an antibiotic, they make me feel weak and just kind of icky. But I really can't, you know, just lay around and sleep because I have issues sleeping at night anyway. And also, most of the time, if I try to rest during the daylight hours, my restless leg starts acting up, and it's gotten to the point that my restless leg becomes restless shoulder and restless, ankle or what have you. I'm really beginning to think that I may be suffering from fibromyalgia. That just has not been diagnosed. I thought long and hard about it. I've listened to several people's stories of their experiences with fibro, and I don't know. There's just a lot of things that sounds familiar, but there's really nothing I can do about it, truly, because I think the #1 treatment for fibromyalgia is like Neurontin, gabapentin, Lyrica, things like that, and I can't take those medications, so yeah. But I'm really beginning to get suspicious that it might be fibromyalgia. And I don't even know if I should get a neurologist and try to figure it out, or just accept that there's probably nothing I can truly do. It's crazy. I did ask my primary doctor about the cyst that was found during my MRI. Apparently, if I didn't mention to you guys, apparently there was a cyst in my sinus cavity. And I think they had put on there that it could possibly be a Thornwalt cyst. I know, I'm full of problems. And my doctor agreed with me that if I'm really not having any issues, now granted I'm having postnasal drip, blah, 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 but if you study up on a Thornwalt cyst, you'll find out that it's a congenital thing that I was born with, so it's probably not that, but he said he really wouldn't, push it if I'm not having any real issues, and I tend to agree. I don't want to go in and have all these tests ran, and they're going to want a biopsy, and they're going to want to do all these things, and I just really don't want to do all that. So okay. I don't think when I picked this out that I realized that there may be this much that I wanted to make green. That's nuts. I bet you guys are already sick of seeing green. But thank you all so much for your outpouring of love and support while Gary's been recovering and everything's been going on my ends. I was humbled by how many of you were just coming to random videos, and making comments, asking for an update, how he was doing. And those of you who are, also over on the Facebook group that were, asking questions in the group. And some of you had sent emails, messenger messages. They were so appreciated. It was just amazing to know that I had so many of you that care so much. And truly, I feel like, I know this may be sad, but I feel like I have more, I feel more love and more support from you guys than I do from my real life acquaintances and even friends. I don't have a lot of close friends, and truly there weren't many people that checked in to see how things were going. So it meant a lot. You guys have no idea how much that meant. And to him also, he says thank you very much, because Every time one of you would ask, I would make sure I told him that my ColorTube family was checking in on him, you know, so he would know, because I do want him to know how positive, how much of a positive effect you guys have on me and, you know, my day-to-day life, because I've said this before, you know, and I'll say it again, when I started the channel, it was for mental health reasons. I wanted to use it for just an outlet for stress, anxiety relief, you know, sharing my love of coloring and my journey as to why I color with other people, and, you know, kind of hoping that it could almost be like an outreach kind of thing where people would know that they're not alone in their struggles. And, you know, I know that means a lot to me to know. It was when things first happened in my life that were so traumatic, I felt like I was the only person in the world who was going through this. And I know that's not true, but that's how it felt. And I didn't do this one. Look at that. Oh my goodness. So, you know, that's kind of the reasons I started the channel. And I want to always, you know, Gary to always know that the time I spend making the videos or thinking about videos that I could make, or, you know, talking about the channel or whatever, that it's not in vain. It's a positive thing for me, for us, for, you know, it's positive. And I want him to know that, because, you know, things happen. Nothing is without stress, you know, nothing. And there's times where I'll run into filming issues. You know, you guys know what I've been through some. And, you know, I'll get so frustrated and just irritated with the whole gamut. And some things were going on here recently that I was just so frustrated about. And Gary brought up a good point. You know, he was like, Donna, if having this YouTube channel is causing you anxiety and frustration and all these things, maybe you don't need to be making any more videos. And that really bothered me when he said that. But then I thought about it and I was like, oh my goodness, he's right, you know? So I did some heart searching and some soul searching, and I'm not even going to lie to you guys. There was a time where I was about this close to making a video and telling you guys, that's it, I'm done, I'm signing out. I'm just going to go back into the shadows of the coloring community. And I sat and I assessed and I thought about it. You know, because I was looking at some of the analytics and, you know, the stats here on YouTube, and it's like my views were down, my watch time was down, a membership was down, and everything that was going on at the time had me frustrated. And I was like, that, you know, no, why am I doing this? But then I really sat back and I thought, and that outpouring that I see all the time from you guys saying, you know, I appreciate what you're doing. The emails I've received where the channel has in some way helped someone, or, you know, what have you, you know, I realized that I get so much positive out of this channel. And I'm not going to quit. So what if watch time's down right now, you know? So what? So what if subscribers are down right now? So what? I came in this with a bang, and I've done wonderful, you know, as far as getting subscribers that I never expected. The channel grew quickly. I didn't really have the opportunity to grow slowly and get things, I just kind of went by the fly, figuring it out as things grew. So yeah, things have slowed down. I couldn't expect things to just, boom, 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 boom forever and, be hunky-dory, peachy keen. And I guess somewhere in my mind, I thought that it should be. And I don't know, just with all the other frustrations. But I think the outpouring of support I got with you guys, especially throughout this, these medical problems that's been going on, has been just so uplifting and reminded me why I'm doing this. And that, at the times where someone may say something or do something that just, irritates me or eats at me or whatever, in the grand scheme of things, that's just not, it's not anything. I've got so many wonderful subscribers, so many of you who I call friends and family now, and yeah, I'm not going anywhere. I'm not. If it gets too stressful, I may make less videos, I may, what have you, but I'm not going anywhere. I'm not letting anything get me down. And I think that was just my, kind of some of my depression acting up. Maybe. It happens. And when you're in a bit of a depressive episode, you take everything in life so personal. And you just feel like everything's because you're not good enough, or everything's because you can't do something right, or you just automatically assume that. And that's what's so bad about depression and anxiety. So I've given myself a little bit of a reality check, and I feel much better. And yeah, I hope that my attitude will improve and continue to improve, because I just want to be positive and all that good happy stuff. And I'm rambling, and most of you are probably thinking, what in the world is she talking about? And I mean, just know that every comment you guys make, every supportive word you've ever said, all of those things, just know they mean the world to me, and you guys are helping me in ways that you could not even begin to imagine. So thank you so much, from the bottom of my heart. I hope that the channel, even if the channel doesn't continue to grow, even if we stay right where we are today, I hope that all of you will still be here with me for many, many, many months in the future, even years, and that we can just have fun together. And yeah, that's what I'd like. So yeah, that's where my mind's been lately. And I haven't been watching a lot of ColorTube lately. I'm sorry for those of you who do make videos. I have not watched ColorTube videos in several days, maybe almost 2 weeks now, since I've really sat down and watched any ColorTube. And I should, and I'm sorry. I've just been kind of caught up in all kinds of things in my head. But I have been watching some different types of YouTube videos. Shane Dawson, love him. Oh my goodness, I have fallen in love with his channel. His conspiracy videos especially, I love them, I love them, I love them, I love them. And it all started because that silly little Chuck E. Cheese video popped up one day, and I watched it, and I was like, wow. But I totally fell in love with Shane Dawson, and now I watch his videos like faithfully. So yeah, so I watched that. And then today I watched a video by Emily Artful. I don't know if you guys are familiar with her. She's an artist. She does sketches and drawings. And she has this really cool thing that she calls sketchbook story time. And I really like to watch that. She basically talks about things that has happened in her life, and it's just kind of like a diary vlog type thing that's going on with her. And I enjoy it a lot. She can be raw. I mean, she can really be raw. And I like people that are like that because I like real. You know, you guys know that. I really like real. And that's what I get off of Emily. And, you know, I know she's not watching color tube channels. At least I don't think she's watching color tube channels. I'm sure she's never heard of my name, and that's cool. But shout out to her, because the video I watched from Emily today was a video that she did on how she got the scar on her hands. A shout out to you, girl, for the bravery it took to tell your story. It was an injury, and you know, you guys can go watch her video. It's Emily, Emily, Artful, Artful. You can look her up. This one was on how she got her scar, but it was a self-inflicted injury due to addiction. And I was so impressed that she stepped right out there and just shared her story with everyone. And I think that that is a very awesome, powerful thing that she did. It took a lot of bravery. And I know myself, I really appreciated that realness and that honesty. A lot of people do try to hide past addictions. They try to hide things from their past, and it's just like with me and my channel and wanting to help people. I've shared some pretty personal things, and it takes bravery, you know, to do that and to really throw yourself out there in social media. And she has a lot more subscribers than I do, so I mean, she really threw it out there. And that's awesome, because I think that when you've survived addiction, and you know, I was very highly addicted to prescription medications that were given to me by prescription, by a doctor, and in her case that was not the fact. I mean, it was different addiction, but to different things. But at the end, it's all the same. It doesn't matter, in my opinion, how an addict became an addict. And I know there's a lot of people who are on medications that are prescribed by a doctor, and they're addicted. They may not realize that, and they don't want the term addict to be applied to them, because when you hear the term addict, you tend to think of, you know, drugged out people on the street committing crimes and doing all these things, you know, for their next fix. And that does happen. But the truth of the matter is that there are just as many people out there who are just as addicted as someone on crack cocaine on the street. They are just as addicted to their prescribed medication from their doctor. And they may not be able to come off those medications due to different health reasons. And but that doesn't mean that those medications aren't harmful. I know mine were. I have permanent disability now due to the medications that I was on. But, you know, and I've said this before, especially in a live stream once, that it's not that I don't believe in medications if you absolutely have to have a medication because of a disease process. That I understand that completely, and I'm not downing that, but for me, I know my experience, and I avoid medications at all costs now. Some medications I don't have a choice but to avoid. But I guess my whole point to that is even though they're prescribed, you're still an addict. Addict means you're addicted, and you know, that's all it means. And I don't think that that's something when we're recovering addicts. And I do say recovering because I believe it is no different than alcohol. I don't believe that there's any such thing as I used to be an alcoholic. No, you are always an alcoholic. I did not necessarily believe that way until I went through my personal experience with addiction and withdrawal. And now I realize that that is 100% true. Once you are an addict, you are always an addict. It makes changes in your brain that can be very permanent, and most of the time is permanent. It changes your wiring, the way things happen, and it just does. And I could really resonate with the things that Emily was talking about. She was getting very emotional, had to take several breaks during her 20-minute video with her story because it was such a emotional, physical response that she was having to the topic. And I get it. You can be a recovering addict, but you're always an addict. You can be recovering and not an active. And I say that because I've lived it. I've been there, and I'm not ashamed at all. Like I said, the things that I were addicted to was perfectly legal. It was prescribed by a doctor in whom I trusted. And maybe that trust may have been slightly misplaced. A little salty when it comes to how I ended up where I am. The answer is not always just to make somebody feel better. Sometimes the right thing to do is the hard thing to do, and I think the doctor should have forced me into more cognitive therapy. But that's neither here nor there. When I had a separated rib in 2000, was it 2000? I believe it was October of 2017. I sustained a separated rib, and I didn't want to take any heavy medications. And eventually the doctors were like, you're going to have to take an opiate for this. It's the only thing that's going to work. And so they were right. I was in a lot of pain. After only maybe a week of taking as prescribed opiates, I felt what happens. I mean, I felt it. And I'm sure it happened from the moment I took that opiate because I just have a very addictive personality anyway. And opiates do affect some of the same areas of the brain that the medications I was on affects. And so I'm sure it was almost an immediate response, but I did not notice for maybe a week or a little over. And then all of a sudden, having a clear, sober mind and not being clouded from addiction, I felt it. It was a desire for the drug was starting to kick in. It was more, all of a sudden, it become also what that drug would make me feel like, more so than, and that was a scary reality for me to come to realize. And that was the moment I accepted that I was an addict, and used that term, addict. And that's when I realized that I'll probably always be that way. I'll probably always crave that false sense of things being okay. And, you know, to hear Emily's story and then the way she was having that physical reaction, and it just, I felt so sorry for her. But you know, hats off for the honesty, because I think more of us who have been through these type of struggles need to be honest and not ashamed, because our stories can help so many other people. We just have to be willing to put ourselves out there and to share those stories. And you know, if you have a presence on social media, and if, you know, you have people who are listening to you, you should, if you have that type of a past, I believe that you should share that past in hopes of helping someone else who's struggling. Maybe you'll help someone who's going through what you went through. Maybe you'll help someone who's coming out the other side, just to keep them strong. And maybe if, you know, you're lucky, maybe you can help someone avoid ever being in the position that you found yourself in. And, you know, that's always what my hope is that, you know, I can't help anyone avoid the tragedy that led to my addictions and ultimately almost losing my life. I can't control the tragedy. I can't help people ensure that that type of tragedy does not happen to them. But what I can do is let people know how unhealthy my response to that tragedy was, and the damage that my response, my choices that I made, and how I dealt with the tragedy, how damaging they were, both to myself and to my family, to anyone who cared about me. Yeah. And, you know, maybe in some way, that may help. I can tell you that for me, when I was in the throes of my addiction, even though, you know, it was legal and prescribed and, you know, all those things, it did get to the point where I was taking things much more frequently than prescribed. Excuse me. That is what happens with addiction. It always takes more. It's just a matter of time, and you're going to want more. But when I was in the throes of that, it was hurting my loved ones and people who cared about me, and it breaks my heart now to be able to really know and understand what I was putting them through. And it's a miserable life. I mean, addiction is lonely. It's so lonely. It's just a very lonely addiction, or a life, you know, when you're living that life of addiction. And I wouldn't accept that I had a problem if, you know, Gary told me several times I was an addict, and I would get so angry and defend myself. I would say that, you know, I need another dose of this, or I need this, or whatever. And he would be like, yeah, spoken like a true addict. And I would get so angry with him. Now I see he was right, you know. He was 100% on the money. And it's a hard road to hoe. So I just say all that to say that, you know, like I said, shout out to Emily Artful for that honesty, that dose of honesty that she gave, and publicly talking about her scar and her self-harm and her addiction and her recovery. It's just, I love stories of recovery. I truly do. You have no idea how, if you haven't lived through addiction, either yourself or with a loved one, you have no idea how precious the word recovery truly is. And what you have to understand about recovery is that recovery is not a destination. Recovery is a journey. You never recover from addiction. It's always going to be a thorn in your side. It's always going to be right there just below the surface. And it's tough, you know, it is, because you've been in a situation that, in a time in your life where you had a substance or something, there's all kinds of addictions, that would take away pain, whatever that was, you know, for you. And when life gets tough, and life's tough, okay, let's admit it, life's tough. And when life gets tough and things start going crazy in your life, it is so hard, because those are the times where some part of you thinks, oh, if I could just, you know, if I could just still do that. And what keeps you from doing that is whatever your motivator has been. For me, I'm going to be honest, my motivator was extreme pain. I went through the worst neurological issue that I could ever imagine. I suffered greatly. I was in a lot of pain for many, many, many months. And I did relapse a little bit. Same doctor, knew the problems I had been through, and I managed to talk him into writing another prescription just for a low dose as needed, just in case, you know, I'm recovered, you never know what may happen. I have bad anxiety, and he wrote the prescription, and I relapsed a little bit. Nothing like before, you know, but I realized real quickly, I can't do that, because luckily for me, when I do put that substance in my body has a violent reaction to that now. So pain is my motivator. I don't want to hurt. I don't want to not sleep. I don't want to have jerks. I don't want to trip and fall and do all these things that happen to me because of this substance, of this type of substance or substance. And yeah, so I mean, that's my motivator. Some people do have other motivators, and it's sad that it took that much pain, but you know, Gary was real quick to point out to me that, you know, pain is a very powerful motivator, and it is. But, you know, everybody has their thing that keeps them strong, that keeps them in recovery. And sometimes it's hard, because that desire never goes away, because you've had a time in your life where you figured out a way to take pain away. You figured out a way to check out from reality for a little while. You figured out a way to take that weight off of your shoulder, and it's tempting. Oh my gosh. I think the strongest people alive are recovering addicts. I truly do. Because it's not a destination. It's not something you just get okay and you're fine. Oh no, you struggle every day for the rest of your life. In the very beginning, it's super hard, because I'm telling you, the cravings are bad, so bad. Even after the physical addiction part, the physical withdrawals have passed, there's still that mental battle that you fight, because you used that substance, my goodness, I can't speak, as a coping skill. You know, most addicts, I believe, are people who lack coping skills. They did not have the coping skills needed to deal with whatever. And there are some that are created through, there's a lot of people who are addicted to opiates that, excuse me, suffered injury And so that's a little different in the sense that that was necessarily not from a lack of coping skills. They needed that for pain, and the end result was addiction. Opiates are very, very addictive substances. But until you develop, and you have to, as a recovering addict, you are forced real quick and in a hurry to develop some type of coping skill that is not harmful and negative. For me, part of that coping skill was coming back to coloring. After my trauma, I turned to coloring. I was in the throes of my addiction. You should see some of the coloring pages I have found from when I was in the throes of addiction. Oh my goodness. You know how you guys will say, oh, you pick great colors. Oh, you're so great. You have this does so well. And yeah, it was definitely not like that. I assure you. I see some of that now and I'm like, what in the world? I've thrown most of it away as I found it. I should have saved it. But just kind of a reminder. But as part of my recovery, I turned back to coloring. That's when I really started using it as true therapy, both for the recovery and the depression and the anxiety and just everything. And that's working for me. That's one of my coping skills. But you have to develop those skills because you don't have a choice. You know, you're put in a position you don't have a choice. And I guess technically you do. I mean, anybody could choose to go back to their addiction. I have a hard time doing that because it causes a massive amount of pain. But, you know, it is a thing. Look, I forgot the green. But I just say all this to say, you know, I really want people to understand how hard addiction is. And I see this so frequently where people think negatively about people who are in addiction. Okay. I've heard some horrible terms get thrown out at people, whether it's people on the streets or, you know, what have you. I've heard horrible, horrible things be said about people who are addicts. And the one thing I want everyone to understand, and this is kind of like a goal of mine when it comes to wanting to educate people on addiction and recovery. The one thing I want people to understand is you, yourself, your child, your significant other, whoever, they are one tragedy away from being that addict. You may not think that way. You may think, oh, that could never be me. Yeah, that's not true. Don't even, not for a minute. I assure you, it is there, but by the grace of God go I. For me, the situation was that I had basically had a nervous breakdown, and my doctor had decided to treat my anxiety with benzodiazepines and my sleep problems with sleeping pills. And then my daughter died. And when my daughter died, you better believe I was using those sleeping pills and I was using those benzodiazepines. And it got out of control, and it got bad. It got real bad. And had my daughter not died, I would have definitely at some point had to face the music and admit that my body was physically addicted. And I would have had to have eventually came off these things, and it would have been hell anyway. But I don't believe I would have ended up the way I ended up necessarily. But yeah, I mean, my daughter died. Say you won't take, someone can say all day, I would never take prescription drugs in any way other than how they were exactly prescribed. And even that can get you addicted. But, you know, say that, but then let your child die. And you have something that can take that pain away, at least for a short period of time. If you don't do it, hats off to you. You're a very strong person. But the point I'm making is that one step away, one tragedy away, and that addict that you're putting down could be you. That addict you're putting down could be your child, your husband, your mother, your father, your aunt, your uncle, your friend. Keep that in mind when, you know, you're throwing stones around, that there but by the grace of God go I. I would have never imagined myself as an addict. Never. And you better believe that now I don't see, when I look at someone who's suffering from addiction, I don't see an addict. I see a person who I pray is in the future in recovery. I try to look past that addiction. It's addiction's a horrible disease. And, you know, I've heard so many people say, well, they chose to be an addict. Maybe. I didn't choose to be an addict. I chose to take medication. I chose to want to feel better using what I believed to be prescription medication that wasn't going to hurt me, and I became an addict. So it's just real hard for me when I hear people talk terribly about other people who are suffering from addiction. It's a battle. It is truly a battle. And when you're in the throes of addiction, you're in a battle for your life. And even after, when you're in recovery, it's still kind of a battle for your life, you know. You guys just, if you haven't been there, I don't expect you, you know, to truly be able to understand. But it's a very sensitive subject for me. And I mean, the only reason I really brought it up is because I saw Emily's video today, and I just loved the fact that she threw that honesty out there, that she wasn't, I mean, it was kind of a, there's no shame in my game, and I loved it. It really, really resonated with me, and yeah. So anyway, I'm really sorry that I went off on that little, I don't want to say tangents, but you know what it was. It is what it is. Okay, let me see. I'm trying to decide what to do here. I don't know yet. Okay, I'm gonna finish this up. I think I'll use this vivid pink maybe. I was just looking for, I didn't want to change from pinks to purples or anything like that, because I'd pretty much done this with a little bit of yellow as an accent. And then everything else was shades of like pinks and greens. So I definitely didn't want to just throw another random color in. I thought that might kind of be too much, and I'm not sure how this is going to necessarily look, but we're going to run with it. Sometimes I get into a mandala and I kind of feel like I colored myself into a corner, and I'm like, okay, what color can I throw in now and it still look cohesive? here we go. I do hope you guys are enjoying the Mandala Mania. I have enjoyed it very much. Please visit Michelle and all the other girls, Samantha, and anyone else who is participating. I have not even had a chance to watch Michelle's video yet to even find out who all the co-hosts are. I feel horrible for that. But yes, be sure to go to their channels and watch their videos also. Show them some love. I've loved seeing your pictures that are getting posted over on Facebook. I haven't even been able to keep up. There's been so many mandalas posted. I can't. I have not been able to keep up and comment on all of them, and I'm sorry, but I am seeing them, and they look wonderful. If you want to join us on the Facebook group, the link to the Facebook group is in the description just below this video, so you can find it there. And join us over on Facebook and share your images, not just for Mandala Mania, but anything that you've colored. It's a good group of people over there, very supportive. I enjoy everyone so much. And again, seriously, thank you all for your support, for me and for Gary through everything that we've had going on. I hope maybe with my discussion today, you can see even more how much it means to me to have you guys, and how important all of you are to me. I'm sorry we kind of went off on a tangent. It was very random, but yeah, it's a topic that I'm very passionate about, and when I get the opportunity to share, I do like to share. If you like seeing sketching, painting, coloring her, her images in the ways that she does, for sure visit Emily Artful. I really enjoy her sketchbook story times. She's fast-paced and just really easy to follow, and I like listening to her stories. She's a great storyteller. It's awesome. Okay, and here we go. This is my mandala for the day. I hope you guys have enjoyed this. It is from Mandalas for Relaxation and Meditation. It's 40 mandala designs, Camellia Angelkova, and this is the one I did today. I did these with the Artify dual end markers. And if any of you do have these markers and have this book and you wanted to color along, to color this also yourself, if you wanted to use some of the colors I used, I forgot to tell you guys what they were. I did use 87, which is Azalea Purple, for my dark pinks. My this brighter medium pink that I put in later was number 6 Vivid Pink that I put in towards the end. The other pink is number 7, which is Cosmos. My greens were 46 Vivid Green with 59 Pale Green. And then I used 37 Pastel Yellow for my yellows. There'll be links also to the Artify markers in the description, as well as to this book. Thank you for all of your support and love. And until next time, peace, love, and happy coloring. Bye, guys.